So one of our more popular or procedures that we do often or more often would be the facelift. And I get a lot of questions about what is a facelift versus a mini lift. And people have done a little bit of research and they see this surgeon does mini lifts or lifestyle lift or image lift or whatever you want to call it. And putting a name on things I think can be good for advertising, but I like to really approach it as like, what are you really doing? What are you lifting? Where are the incisions? And I think that's more important than just the name of it. So a mini lift may sound great and may sound like this is less, and this is not a surgery because it's got the word mini in front of it and must be a no big deal. But that's not necessarily true. My definition when I'm discussing a mini lift versus a facelift, mini lift, you're going to have the incisions that go around the ear and the backside and down the hairlines on both sides. If I say a facelift, I'm adding a incision underneath here and I'm going to the muscle, that's right there, that's called our platysma, and I'm doing a platysmal plication. I'm getting some fat that may be underneath that platysma, and so it does do a little bit better job for the neckline. Not everybody would benefit from a facelift because they can get the exact same results from a mini lift. Both of those are still going to be what's called a deep plane facelift, meaning that I'm going underneath the SMAS or the superficial muscular aponeurotic system. And in my hands, I just feel like I get better results, longer lasting results. I like to discuss what we're lifting in the face, what's the dissection plane, where are those incisions or those scars going to end up. Some people say, I would never have a full facelift. That sounds like it's too much. And so they'll say the mini lift sounds better to me. But again, there's not a very big difference on the incisions. Doing a full facelift, when I'm starting to think of full facelift, I'm thinking more of an extended facelift or something that I'm doing to treat the upper face, the brow area, because then you're treating your upper face, your mid face, your lower face, and your neck. But in general, most people, when they're thinking of a facelift, they're talking about a lower face, jawline, neck lift. When I discuss surgical procedures, whether it's a facelift, a mini lift, an extended facelift, I give the option to my patients whether or not to have the surgery done in the office or in the operating room. And I understand that the anxiety or the nerves that people may have when saying having it done in the office and it's not general anesthesia, that seems to be a lot. And I just cannot wrap my head around that. And to kind of help out with that, when I am doing a surgery in the office, I tell my patients it is not general anesthesia. We do not start an IV on you. I don't have a anesthesiologist who's monitoring your vital signs, but we are giving you some medication to help you relax by mouth. It's similar to the types of medications you take if you were anxious about having an MRI and you didn't think you'd be able to sit still. We do give a decent sized dose and we do monitor you as far as that goes. But it usually helps you get through the numbing process. Once you're numb, you don't feel anything. And we're able to do the procedure most of the time very, very easy, and patients are very comfortable. More often than not, patients state that it was easier than they thought it was going to be. We are just kind of moving some tissue around. I tell patients if they were going to go have a skin cancer cut off their face at a Mohs surgeon's office or another surgeon's office, most of the time they're not getting anything to help relax them, and they just get numbed up and they don't feel anything, and they do quite well with it. This is just a slightly larger area that we're moving, so patients tend to tolerate it very well.